Hi, this is Mark Grossarth from Heritage Family Credit Union. Heritage Family Credit Union is a proud sponsor of the 2020 Bennington Chamber of Commerce Lunch and Learn series. I hope you find these seminars insightful and educational.
Good afternoon, everybody. I'm Matt Harrington with the Southwestern Vermont Chamber of Commerce, and you're joining us for another special COVID-19 telecast in CAT TV studios. We want to thank the CAT TV staff who are essential and continue to provide this essential service to our communities throughout Bennington County. So I want to thank them personally for having us here once again. We have another one tomorrow, so please tune in tomorrow as well. That'll be more of a Zoom call with an HR expert, so if you want to listen to that, tune in tomorrow. But today, we actually wanted to bring back Southwestern Vermont Medical Center and their CEO, Tom D., as well as their Chief Medical Officer, Dr. Trey Dobson. So again, thank you guys for being here. It sounds like we've got some updates to make to our community. I've got a list of questions I want to ask you, but Tom, maybe you can start with a good overview of where we've been since the last telecast we did together and where we are now.
Well, thanks again for the invitation to come today. And first, I would be remiss if I didn't really thank the community for really an unbelievable response in terms of their support. It's really something I've never seen in my entire close to 40-year career as in the healthcare field. You know, every day we're receiving social media messages and emails encouraging our team, providing support. We have businesses and individuals who are actually manufacturing PPE, masks, and face shields and sending them to us, and it's been wonderful. The donations of food that we have, individuals working through local restaurants, which really is a win-win, and they're donating food to our staff, which is very much appreciated, and of course our COVID-19 relief fund, which it's only been in existence now for about 3 weeks, and the outpouring of support there is unbelievable. We've had over 425 donors. We've raised $430,000 in 3 weeks, and led by the support of our auxiliary and some board members. But everyone has been stepping up, and from $1 to $5 up to $10,000, and it's really says so much about the heart and spirit of this community. So I want to really thank everyone for supporting our hospital, our employees, and certainly our patients in this time of need. The hospital itself, of course, is going through very, very challenging times. I say this is probably our biggest challenge since the fires that the hospital incurred back in the 1920s, and we've been weathering this storm, again led by Dr. Dobson and his leadership on the clinical side, our incident command. But the hospital is feeling the impact. I mean, one of the things that we're very fortunate, I think Southwestern Vermont Medical Center is one of the strongest, most stable hospitals in the state. So we've been able we're weathering this storm, but certainly we're feeling the impact. Our clinical business is off by 60%, and again, we made a decision also based on the governor's order. We ceased doing elective and non-urgent work, and we're feeling that impact, but we will survive. I mean, people send me notes asking, will the hospital weather this storm? And I say we will get through it. This will take some time, but I'm sure that we will regain our financial footing over the next couple of years as we get back to normalcy. I do want to just make a note and still let you know we did furlough employees, and we've had over 100 furloughs, and we just want to let you know we continue to keep them in our thoughts and prayers, and we stay in contact with our employees, and we're looking forward to the time that we can bring them back, hopefully sooner rather than later, and they are missed. And as we're starting, we'll talk a little bit about this today, as we're starting to develop our plans to get back to more of a regular schedule. That's when we hope to start to bring these employees back. The good news is, through the state unemployment office, most of them have been starting to get their unemployment checks, which helps a lot. Again, through the program that both the federal government created, with the additional money in the state system, most of our employees are being kept whole, and that's something that we're we're very, very happy about.
Absolutely.
And we're concerned about our whole workforce as we go forward. This is both a physical, emotional drain on people. They're dealing with a tough work life and also a difficult situation at home. So continue to keep them in your thoughts and prayers. And we have a lot of support organizations around us like UCS and other organizations that are providing employee assistance when we need them. So we're happy, but we're going to be a lot happier when we can get back to our normal routine.
Absolutely.
And I know Dr. Dobson actually has been working on a lot of that work.
Dr. Dobson, give us a general update. I think from a state level as of today, the 23rd of April, it sounds like from a national scale that Vermont's doing quite well and better. Where are we at in terms of what you see as a state and then what you see as a region?
Sure. Well, and you're correct, Matt. We seem to have weathered a storm of a surge of patients that would be beyond our capacity. So it does not look like that's going to occur. People see that in the media, and that's what the state's models are showing. We do predict, though, that the numbers of patients in the hospital requiring intensive care and hospitalization with COVID-19 will increase throughout the summer as the mitigation restrictions are lifted and into the winter months. Possibly along with the influenza that will return. And so we are ready, and that's what we are planning for and gearing up in the long term. In the short term, we're ready to return to normal operations. Everyone's aware that there's a governor's directive out there that prohibits elective procedures and patient encounters right now. So we're working with that timeline, which is set to expire on May 15th. So we're looking at that following week to have a phased-in approach of elective surgeries, procedures, laboratory diagnostics, radiology studies, and then encounters in the outpatient offices.
Great.
I just want to say one thing, Matt. I just want to let the public know that the hospital is a safe place to come
Absolutely.
to. I mean, a lot of people are concerned about, and they're trying to avoid the hospital at times when they should be using us. And we all hear these anecdotal stories of people who are delaying necessary work that they need to have, and it's starting to impact their health. So I just want to stress one more time, stay in contact with your physicians, and please don't be afraid to come if you need services. That's why we're here, and we're taking extraordinary steps to keep all people, all visitors safe and patients. So please, keep that in the back of your mind, because we're seeing a drop off of business that we're surprised we're seeing.
Sure.
Yeah.
Let's talk a little bit more about that restart. I think phase one has started to roll out with construction and outdoor businesses being able to reopen. And Dr. Dobson touched upon it a little bit. But Tom, talk to us a little bit about what that means for the hospital in terms of a phase restart. I think both operationally, but also what you expect to see. And then what does that also mean for the region?
Right. Well, first let me start with the region real quick, because we're all part of the Putnam project, and we've been, this was a difficult time where the project stopped for a period of time. We had 100 workers down there working, so that was very disappointing. But with the phased restart, now we can get back into and start getting that project. We won't have 100 workers there, but we'll have like 30 or 40, so we can start to get that project going again. And our goal is to really try to have it ready by the end of this year, the phase one. So we're getting excited about that, and we're getting geared up. But for the hospital, we are staying very close with the governor's office, with the Commissioner of Health of Vermont, with the Department of Health, and we're going to work in lockstep with them. We're talking to them every week, and again, Dr. Dobson is leading our plan in terms of developing the initiatives of how we get geared up for that. But it's not going to be we're not going to just turn the light switch on and get back to normal operations. We're going to do it on a gradual basis, but focusing on the more pressing needs first and the most pressing patients.
Sure. So when people have the fever, cough, and shortness of breath, as we've talked about, they still need to try to stay at home if they can and be managed by their doctor or their provider on the phone. That hasn't changed. What has changed is our ability to start seeing patients who have other symptoms that may have in the past been able to wait for a few weeks. Unfortunately, when they wait too long, they get severe and the patients end up very sick. So we are gearing up to be ready to see those patients in the outpatient practices, in the surgeon's office, in the emergency department. And again, it's going to be a phased-in approach, working with the governor's directive and also the Commissioner of Health, as Tom said, but also all the other hospitals in Vermont. We're making a collaborative effort. How do we do this? When we say it's a phased approach, it'll still be pretty quick. We're talking a matter of weeks, not a matter of months, and we'll be communicating that out.
Great. Along those lines, so now individuals can start to do things they weren't allowed to do a couple weeks ago. What are still some of the real big precautions that you would recommend for people kind of out there, with PPE and things like that?
Sure. So for the community, we are very much remain in mitigation strategy. We are still doing social distancing, and that's going to be around for I'm going to say for months. We don't know what that end date will be. It's possible that there are some types of social distancing that remain in place throughout the year. They are to continue wearing masks. Again, the masks are to try to help prevent spreading the disease. That doesn't do much for preventing contracting the disease, but spreading it to others. And until those recommendations are lifted, patients should continue to do that. Now, in the hospital setting, we're wearing masks 100% of the time, surgical grade masks at the minimal. If we're working with COVID patients, we of course wear the respirators and equipment that people have seen on TV. And we'll continue doing that probably past 2020. We'll be doing that until the pandemic is completely over and the risk to staff has dropped to zero. Right now, it is extremely safe moving forward to be in the hospital setting. And in fact, I would venture to say it's safer than being in other areas where you may gather.
Sure. Let's talk a little bit about those masks and those types. And I'm sure people have a lot of questions about the personal mask at home. When do I throw them away? How do I wash them? When do I wash them? But even in terms of the hospital, and let's talk a little bit about those masks. And then obviously we had a great big donation by MAC that I think we'll want to talk as well, and that great partnership that emerged over the last week. So Dr. Dobson, why don't we start with you, but then Tom, I'd love to hear your thoughts around MAC's contribution.
Sure, I'll just briefly talk about the masks, since that's where you're, the types of masks that we use in a hospital to provide oral care and care right up next to a patient who could potentially have COVID or other respiratory illnesses are called respirators. And there is the N95, which has been publicized greatly because of the shortage. That's a disposable respirator. We also have non-disposable respirators. Those are used in the healthcare setting by staff working directly with patients that are suspected of having the disease. The remainder of the staff are wearing face shields, which are clear plastic shields just to prevent splatter, and then a particular type of procedure mask that has a very fine filter. These are quite different than the masks that the public is wearing that are homemade or purchased online, and those are perfectly acceptable for being in the public, and the purpose again is to try to prevent that transmission or reduce it. But they're not of the quality that we would work with in a hospital setting. So people are to continue doing that until both state and federal recommendations say we can stop.
In regarding Matt, the MAC, we're fortunate. Kevin Daly works for us. Kevin's our Vice President of Human Resources and was a senior executive at MAC for 15 years. So when we were looking at our need for developing additional PPE equipment and the need for a full face mask that would act as a respirator, we didn't have enough of those. And Kevin said, MAC is a very talented team with their subsidiary corporations, and I bet they can make something for us. So he reached out to them, and all of a sudden, within a matter of a day or two, their team was working on this, and they came up with an underwater mask very similar to a snorkel mask. Wow. And they manufactured, jerry-rigged that into one which could be used in a hospital setting, and it's really quite remarkable. I think we call it the Ocean Reef mask, and we have and they developed 500 of these. So we may be one of the best stocked hospitals now in the state in terms of having especially respirator masks for our staff. And we're working through, there's some nuances we have to work in terms of those, but overall they're working great. We have an individual mask for each of our key employees who were doing clinical work, and Mac just really stepped up, and they did something. They have a tremendous innovation in their corporation, and this is one of the, I think we're one of the first in the country at something like this.
Are you noticing other partnerships? I mean, we've talked a little bit about the meal train that was set up, and so you've got local restaurants working with citizens to deliver meals. What are some other community things, or have certain companies, businesses really kind of stepped up in the way that MAC has?
Well, Mac is probably the best example of what I would say is true innovation. I mean, we certainly have. I know, for instance, Orvis just recently donated to us a whole series of N95 masks, which was terrific, and regular everyday masks too. And we have a lot of examples of different businesses. I mean, you may want to talk about some of the kids who are working on the face masks.
Yeah, so these face shields that I just mentioned were in short supply, and in fact many hospitals have incredible difficulty getting a hold of them. And so several individuals using the internet to connect recognized that it's pretty easy to make with a 3D printer, so they've been making those and making parts of them, and they come into the hospital, and now we actually have so many that we are prepared to distribute them to other organizations that need them.
And one of those is his son, who
Gotta put him to work early,
made this.
right?
And
Yeah.
That's great.
He
That's
told his
great.
dad about it. So those are just, there's lots of stories of people just going out of their normal work zone to help us out, and we're just really appreciative.
Oh, that's great. Let's go back a little bit to the state's modeling and surge planning. Can you help us? We're now suggesting that we may have kind of weathered the biggest part of the storm. How do we figure those numbers? What is that safe data set? How do we know that? What are you looking at, Dr. Dobson, and how are you making that educated decision?
Yeah, boy, it's hard. We've talked a lot about the difficulty in two things, really: understanding this virus and the disease and how it propagates, and then as well as society's responses to mitigation strategies. Those two aspects were poorly defined in the early models, which is why we had these pictures on the front of the newspaper that sounded like doomsday was going to take us all. Fortunately, society responded. And we also know that urban areas, even with mitigation strategies, are just much more difficult to control than rural areas. But it is the math behind the spread of communicable diseases without a vaccine and without treatment is well established. It's just the speed. So we know that more people will get the illness. It'll be spread out over time, and that gives us time to perfect treatment. It gives us time to make sure we have the resources in the hospital systems and in the outpatient care settings. So we see that the volume will, to repeat earlier, what I mentioned earlier, will increase over time, but hopefully at a manageable level, and the community can return to getting back to work and the social gatherings that are important.
We're still doing a fair amount of testing, Matt. That's actually been increasing. But the hospital itself, I think today we only have one inpatient COVID patient. So it's a very manageable level right now. But we're still taking full precautions, both inpatient and outpatient. But again, as Trey said, I think we're the peak now. We think we're beyond the peak for now, and now we're on the downward cycle, and hopefully we can start to take steps to bring us back to a normal operation.
Sure.
What we have that's helped through this, I just want to put this out there. It's a little bit unique in healthcare, but it's certainly specific to Vermont, and that is a board and an administrative team that recognizes clinical input. So the nurses and the physicians aren't told what to do. They are a part of all of the decision-making process, and that's why we know that our protective personal equipment, or personal protective equipment, is the top priority, and that staffing, it has to be looked at first, and then we can do the mission of the hospital.
Great. Let's talk a little bit about staffing. I think on one of the first episodes we asked about the morale of the staff. Here we are, I think 30 days later or close to it. It is, I can only imagine, been a grueling kind of time We were talking a little bit before with all the work they're doing at the hospital, and obviously the added stress of all this, and then getting home, and they have children at home because school is out, and perhaps a significant other that's not working. Talk to us a little bit about the morale of the staff, and maybe a good story or two that you've heard about them coming together.
Yeah, I think that overall, I think the morale has been remarkable, and Trey just talked about it. I think it's also the team members working together, the doctors and nurses coming together, solving problems together. It's really been very remarkable, and I think that's what makes us a kind of special organization, is that our clinical, especially our clinical teams, they know that they need to collaborate to be successful, and I'd say that the staff, everyone is still anxious. That doesn't go away. They realize that this is a difficult disease, and it's a dangerous disease. But I think they feel very good about this level of equipment they have now, the protections we've incorporated through negative isolation rooms and getting appropriate garments and headgear. So I think we've taken all the steps to make people feel that, all things considering, they're in the best possible spot.
Yes, and I would say, most organizations our size or even larger don't have an infectious disease physician like Marie George, who's just come in and made certain that we're safe and that we're doing the most up-to-date things for taking care of patients. We have treatment plans for this summer that are normally done at tertiary care centers. We also have an emergency department and an inpatient staff that are led by nurses and doctors that are of just a really high caliber, collaborating with Dartmouth-Hitchcock, and that gives the staff confidence. And now that we've gotten through this first phase, the anxiety is not going to leave, but it has decreased to the point we know what we can do. So it's now saying, now there's been a little bit of a shift, Matt, towards people saying, well, we need to get back to taking care of patients' other illnesses. We're getting a little antsy, to be honest, and so that's why we're ready to move forward.
So let's talk about that. I know we mentioned it earlier, but we've had some more people join us. And if you have a question for Dr. Dobson or Tom D., please put in the comments and Facebook Live. We'll try and get to those. But talk to us about the restart of normal procedure again. When should we expect that? And what have they been doing? If they haven't been doing those procedures, haven't had those procedures done, what have they been doing in the meantime? How have we been keeping them healthy?
Sure. Well, so some caveats here that we have plans and we're developing those daily. There are variables that are a little bit beyond our control, including what Tom was referring to with the state, and we want to make sure that we are in step with the state and recommendations. And there's also, as everyone knows, just the unknown of this pandemic, and things can change. But we have been doing, urgent and emergent procedures all along. We've had a robust labor and delivery ward moving forward. Surgery still occurs when patients need it for an emergent need. But we're ready to start putting back some of those surgical procedures and radiology studies that were put on hold. So people have been waiting. Unfortunately, that's been the detriment of some. They're scared to come in, and that's what Tom's comments are. We're ready to take care of patients. You don't need to be scared to come in. If you have a cough, fever, shortness of breath, and you're okay, stay at home and talk to your physician on the phone so that you're isolated and you're not spreading COVID. But otherwise, whether it is a simple inguinal hernia repair, whether it's your mammography, that's what we're getting ready to put back into place. And again, I don't want to be too definitive because it could change, but we know the governor's directive ends on May 15th, so we anticipate that following week to start phasing in these procedures.
But we have to also, Matt, be ready to move quickly, especially if there is any type of reoccurrence. And I'll give you an example. One of the very areas of exposure and concern and potential hotspots are long-term care facilities. I think we all know about the facility down in Williamstown. It's had a very difficult, terrible time there with the number of loss of life. So we had one of our residents in CLR, our nursing home, was transferred here from another institution, and the resident tested positive. So right away, we kind of locked down that area. We had all those residents in that area tested. We had all the employees tested. We discovered that one of our employees was also testing positive, so we had the entire workforce tested in CLR and all the residents. And I think those type of quick action is an example of how we need to deal with this going forward. Is not to be laissez-faire, is to plan for the worst, and hopefully that won't happen.
Yeah. Let's talk a little bit about at-home testing and where are we at now in terms of any type of vaccine, and I don't know if anything's changed over the last 30 days, but Dr. Dobson, you might be the closest to the answer, if there is an answer.
Well, certainly, I will say that I read the literature daily. I read the reports, not only in the media, but in the medical literature where you're gonna find it. But I'm not an expert on vaccines. I'll say on vaccines, nothing much has been released of substance in the last 30 days. As far as testing, we grow more confident in our testing of whether or not someone has the illness. The type of that particular type of testing is referred to as PCR testing, and we have more confidence that patients that have minor symptoms we still should be able to pick up, but we don't have a defined level of the false negatives and false positives yet. But again, more confidence, so that's good. That means that we'll be able to test more and have confidence in that testing. The type of testing that's been really put out there over the past couple of weeks that we hope will help guide society over the next 12 to 24 months is the serology testing. And what serology does is allows us to know whether or not someone has a past infection and may be partially or fully immune. Now, serology itself is well established. There are many diseases, hepatitis, others where serology works, but those have been refined. So we know we're detecting the right antigen, we know that we're detecting the right antibody. For COVID-19, for the SARS-CoV-2 virus, it's so early. There's 70 plus companies out there making these tests. They're not regulated like they would be in normal times, so we have to be careful in how we interpret the data and how we utilize it. That being said, I'm very confident that within the next four months, I believe we will have good data to suggest that we're on the right track with serology. That's a little bit of a guess, but never before has the whole world been focused on doing something where money is not a factor and time is not a factor. So I believe in humanity.
Yeah, great. For those that are essential workers working, and I'm thinking probably the most visible ones would be the supermarkets. You know, I was in there the other day, and some people are wearing masks, and some people aren't wearing masks. And I didn't know if you had any opinion on that, both from the people going in to shop, but also there are definitely some markets, and I'm trying to think of some other locations where it's interesting that there isn't kind of a not unlike the hospital, kind of a mandatory wearing of masks.
Mm-hmm.
Any thought on that, or why we should or shouldn't?
Yeah. So in federally, it is a strong recommendation by the CDC, or it's a recommendation. In certain states, it's a requirement. I'll just put it this way. It's a recommendation that you wash your hands, and we all know that's a really good idea. If it's a recommendation we wear masks, let's do that. We're in a pandemic right now, and we can sort out later better specifics, but we believe it helps prevent at least some transmission, so we should be doing it.
Okay, great. Talk to us a little bit about telehealth. I think last time we got together, you guys have been working aggressively on your telehealth capabilities, especially as people haven't been able to come to the hospital. Any more development on that?
Absolutely. So before this pandemic, we were the largest partner with Dartmouth-Hitchcock for telemedicine, which was mostly focused on inpatient telemedicine. And that has shifted, where we still maintain all of those inpatient connections, especially in the intensive care unit, which has been incredibly helpful. But also it's been moved to the outpatient, where a majority, which is unbelievable, within a 4-week time period, a majority of our patients in the outpatients are cared for through telemedicine. And by that, I mean specifically the doctor or the advanced practice provider communicating on a telephone screen, on an iPhone or similar device with a patient, and the success rate is over 80% as far as people being able to make that connection, and it's here to stay somewhat. There are certainly many encounters that both the patient and the physician in the past would say, it's too bad we can't do this on telemedicine. You had to drive all the way here for me to do a really quick check, and it doesn't make any sense. But there were regulations in place. There was malpractice concerns that it took a pandemic to quickly remove, and so we will continue using telemedicine, as will the country, once the pandemic clears.
Matt, as Trey said, we are probably the most wired hospital, at least in Vermont, maybe in northern New England, in terms of telehealth, using Dartmouth as our partner. And it really was transformational. I think in this pandemic, if there's silver linings, this may be one of the silver linings, that this service will become commonplace, and we hope to expand it. Our investment's about $1 million a year in telehealth services prior to this.
Yeah.
So we're now into this game big time, and I think we're going to be expanding it. And I think the public will like it a lot. It's not going to replace seeing your doctor face to face, but it's a great adjunct to it.
Yeah. One final question from me, and then I want to have you both leave some leaving thoughts. But as a community that's watching, we want to thank you again for tuning in, and thank Cat TV for hosting us. What can we do to help? We talked a little bit about the meal train. You've got a COVID relief fund. Is there a phone number or a website? Where best do you need the help of the community, large and small?
Well, I'll say one thing, and Dr. Dobson can follow up. I would say where you can help is to make sure you touch base with your physician. Don't let things go to the point where it gets to be severe and affects your longer term health. Mm-hmm. Don't be afraid to come to the hospital. We're here to help. We're safe. Touch base with your provider, and we're all in this together. And I just want to encourage people to know that our services are here to meet your needs. So don't be afraid to use us, and that's one of the things that would help us.
Okay. And I would say the support, including physical things being delivered to the hospital, meals, equipment, has just been extraordinary and remarkable. And I think we're at a point now where shifting that towards the emotional support for the nurses at the bedside and the physicians taking care of patients in the practices, and the nurse practitioners and the physician's assistants, the non-clinical staff at the hospital. That emotional support just goes a long way, and we are greatly appreciative of the community. We're here to provide the care and fulfill our mission.
Great. Also want to do a shout out to thank Cat TV for what they've been doing, and they're also certainly development of the concert series, which has been a terrific thing that just kicked off, and supporting the COVID relief fund. So thank Cat for their efforts. Final
thoughts, gentlemen, for today at least, and if we need to, we'll be back here next week to update the community. But final thoughts, Tom.
Well, it's been the toughest challenge of my career, and I think of the hospital, and we're not out of the woods yet, but we see the light, and we're getting there, and I'm feeling much more optimistic today.
Yeah, we use a phrase every day before we start incident command, is that we are in readiness mode. So as we shift gears to start providing elective care, non-urgent procedures, we're in readiness mode. As Tom said, an outbreak, a clustering will shift us right back. We're not abandoning any of the locations and processes we put in place. We've just stood them down. And then a final thought would be, we're fortunate. Everyone has done an incredibly strong job in the community and at the hospital and the independent practices in the community. But just to remember our colleagues, our families in places like Boston, New York City, they continue to be hammered. They are not experiencing what we are here. And there will be other places that will grow, and we can't forget them.
Great. Well, on behalf of the Southwestern Vermont Chamber of Commerce, Cat TV, and Southwestern Vermont Medical Center, I want to thank you all for tuning in. This will be recorded and up on our website and up on other websites. And if you have a moment, make a phone call, tell somebody you love them. It's one of those good practices. So thank you again for tuning in. We'll be back soon.